Okay, this is a quick review of the anterior triangle of the neck. Remember that this triangle is defined by the sternocleidomastoid here, kind of laterally and posteriorly, the inferior border of the mandible here along the top, and then the midline here toward the middle side of that triangle. So that's the anterior triangle. That triangle is subdivided into smaller triangles, and I'll try to show those to you here as well. So if we look at the underside here, the first of these triangles is the submental triangle, or the digastric triangle. This is formed by the anterior belly of the digastric, the hyoid bone, and the midline right there. So that's the digastric triangle. The bottom of that triangle is the mylohyoid muscle right here. Okay, and other than a few lymph nodes and maybe a little bit of the anterior jugular vein, there's really not much else in that particular triangle. The next triangle is the muscular triangle. I'll show that one to you here as well. This contains most of the strap muscles, well actually all of the strap muscles that are associated with the hyoid and thyroid, hyoid bone and the thyroid cartilage. This muscle is shown here. This triangle is shown here. It begins in the midline, goes to the anterior border of the sternocleidomastoid, and then to the superior belly of the omohyoid. So that's the muscular triangle, and within it you should be able to find a pair of parallel running muscles, and then deep to that a pair of muscles that are sort of arranged in a series. The two parallel running muscles are the omohyoid and the sternohyoid. Now the term omo refers to shoulder because this muscle actually begins down here, coming from the shoulder region, coming up underneath the sternocleidomastoid, and then continuing here. This is the omohyoid. It has two bellies, an inferior belly and a superior belly. The one running parallel to it right here is the sternohyoid. It begins on the sternum and comes up and attaches to the hyoid bone, hence the name sternohyoid. And then deep to that you can see a muscle here, and then up here you can see another one there, okay? These are the two that are arranged in series. This is the sternothyroid, and this is the thyrohyoid. So this one goes from the sternum to the thyroid cartilage, which is this bluish structure you see here. And this one goes from the thyroid cartilage up to the hyoid bone. Thyrohyoid, sternothyroid. Now on this side, those muscles have been removed, at least most of them have. The only one remaining is the thyrohyoid, coming from the thyroid cartilage going up to the hyoid bone. All right, behind that one is the carotid triangle. Okay, this one is formed here by the anterior border of the sternocleidomastoid, then the posterior belly of the digastric, and then the omohyoid muscle here. So that's the carotid triangle. This is named the carotid triangle because it contains the carotid sheath and the contents of the carotid sheath, which I'll go over in just a moment. But that's that. Now the principal contents of the carotid triangle is again the carotid sheath, which is a connective tissue that wraps around the internal jugular vein, the common carotid artery, and the vagus nerve. Now unfortunately on this model you can't see the internal jugular vein, but you can see, if you peek in here a little bit, the carotid artery system, and then beside it you see this yellowish structure that's supposed to represent the vagus nerve. If we go to the opposite side, you can see this the carotid artery system a little bit better. Notice that on this side you can see the carotid artery, the common carotid artery, ascending up through the neck, and then here about the upper border of the hyoid or the thyroid cartilage, you see that that splits into an external branch running forward and an internal branch running behind it. So this is the external carotid here, and this is the internal carotid there. And then beside that, you can't really see it on this side of the model, but running beside it would be the vagus nerve. Okay, we aren't so interested so much in the common carotid at this point, or even the internal carotid, because they don't really give off any branches along the way that we need to understand or follow. But we are interested in the external carotid, which gives off a number of branches here in the face and neck region that we do need to be able to identify. This first branch coming off the anterior aspect of the external carotid artery here is the superior thyroid. This one supplies the upper part of the thyroid cartilage, or not, thyroid gland, I'm sorry. So that's the first one coming off of that anterior aspect. The second branch coming off the anterior aspect dives here behind the this muscle, which is the geniohyoid, right here. This little branch right there that you can see, that is the lingual artery going to the tongue. And then just above that, you can see the facial artery, which comes up, swoops around, comes over the mandible, and then up into the face. So those are the three vessels coming off the anterior aspect of the external carotid artery. The superior thyroid, the lingual, and then the facial. Coming off the medial aspect will be the ascending pharyngeal, and on this model you can't really see that. But you can see coming off the posterior aspect at least one of the two that you should be able to identify coming off the posterior aspect. The posterior aspect gives rise to the posterior auricular artery and the occipital artery. And I think that this is the occipital coming here, going deep, and then coming out back here. So that's occipital. Finally, the rest of the external jugular comes up and branches into two terminal branches. The superficial temporal, which should be at this point kind of an old friend. This is the one that supplies part of the direct supply of the scalp. And then if you can see diving right here behind the neck of the condyle process of the mandible, you see that vessel right there, and that's the maxillary artery. So those are the two terminal branches coming off the external carotid. All right, the final triangle that we need to be able to see is the submandibular triangle. And that's this triangle right here. The upper border is the inferior border of the mandible. Then we've got the anterior belly of the digastric, and then back here, the stylohyoid muscle. So that's the submandibular triangle. The principal structure here, you can see more of the muscle of the omohyoid here anteriorly, and then this salivary gland. This is the submandibular salivary gland, and that's found in that space as well. So those constitute the subtriangles of the anterior triangle. So again, in review, we've got submental or digastric, muscular, carotid, and submandibular.